Perhaps I could kick us off if that's okay. Good morning, everyone. It's great to see so many colleagues joining us this morning, and I'm sure one or two more will be coming into the meeting as we just make a start. So just let me introduce myself. My name's Alison Tong, and I'm the Director of Strategy and Innovation for Arden and GEM, and really great to be invited to open this virtual event today. And we've got a fantastic lineup of speakers who will be introducing themselves as we move through the event. And the whole purpose of the session that you've joined today is to have a conversation, and we're very welcoming of comments and questions in the chat bar. So please take part in that during the course of the event, because we're really keen to hear your reaction, your views, your questions, which I know the speakers will be only too happy to pick up and take on board as we go through. So please see this as an opportunity to interact. But the whole purpose of this event is to have a conversation about how we raise our ambition and raise our voices to looking at the opportunity to raise social value standards across healthcare. And the opportunity we have in front of us through this event is for you to give us your views really about the initiative we've got to create a new award which will recognise that ambition and recognise progress. So if we can move through the slides, I'm just going to introduce a little bit about Arden and GEM. And as I say, we're hosting the event, but we're very much working in partnership with our colleagues today. So Arden and GEM is a national organisation. There's one of 4 care support system providers across the whole of England, and we work to deliver a whole range of professional support services. And our social value offer, which I know Becky will touch on later, is part of a whole range of services that we offer, which are just listed there. And we're very proud to have a culture of collaboration, a culture of innovation, and a culture of partnership working. And we're here to deliver value. So if you can move on, Ariane, thank you. Our objectives reflect this, hopefully, that we have taken on board the triple value for our mission. We're very much focused on adding value and supporting value across the health and care system. And we have adopted 4 key objectives. One is to spread our support and offer our support wide and far, so that we enable the continuing achievement of those AAA objectives across the NHS. Innovating, always looking for how we can improve services, and supporting our talents and our capabilities to work together as integrated teams supporting the health and care system. And then looking at how we impact, how do we create that impact, and how do we measure that impact, which I know colleagues are going to touch on because it's all part of what the conversation today is, how do we know we're doing a good job, really? So, and part of the award that we're creating is part of that journey. Thank you, Ariane. And you'll be aware of the ambition that we have for integrated care in the NHS, and it is an ambition that is that's very much still very relevant for today. But I just want to touch on some of the challenges and uncertainty that's around us. Even though we keep these 4 objectives and the integrated care aims absolutely the heart of what we're trying to achieve here, we have got a whole range of challenges. And I think what we need to be able to relate and communicate effectively is that social value is a lever for achievement and for delivery and enabling us to face some of these challenges. Thanks, Ariane. If we just touch on some of these, that would be great. So I just wanted to touch on, because it's good to have the reality in the room of what we're all facing at the moment. We know that there's a general election coming. There's a lot of conversation about whether that'll be next year or the year after, but we know that is happening. Now, with the NHS, clearly a general election always brings change with it. So that's the uncertainty that we have. But we do have some clear directions in our operating guidance. We know that we've got a real focus on recovery of core services. We've got a real focus on productivity. We've got to, as we recover services, we've got to ensure that we look at those long-term ambitions Now we talk about recovery from COVID. COVID is here as a long-term issue. I was listening to the news this morning, and there's another variant of concern. So we know that there will be a continuing set of issues surrounding that. Really, we're all acutely aware of the industrial action, and looking after our workforce and valuing our workforce is such an important thing. We've lost 9.1% of our employees, and we've got a huge number of vacancies across the workforce. So workforce challenges are very front and centre. We've also got a significant issue in terms of our finances, and you will have heard around that in your own systems, but also nationally, that we take a huge part of the overall taxpayer funding. And so McKinsey have been asked to come in and look at productivity of the NHS. How are we actually measuring productivity and value? And I think there's a linked conversation about the word productivity and the wider value and the impact that the NHS is having. So we need to find a different language and a different set of measures, I think, to be able to demonstrate that. And number 6, elective recovery, but also we've got winter urgent and emergency care. So growing pressures. And if you just look at the urgent emergency care, so far this year we've got over 6% growth in that. So the NHS operates within a challenged environment. Thanks, Ariane. But and this just again is a visual story just on one of those challenges, of which there are many, which is on the elective care and waiting list. If you just take that, you can see that we've got this whole impact really in terms of the industrial action and pandemic, and not only that, but obviously the context around workforce generally that we have in terms of those wait lists and wait times. Thank you. So I just want to take one of those objectives, Ariane, and just say, okay, well, why is social value relevant? And how can we use social value to be able to make the link between what we're trying to achieve here and some of those big pressures? And that's the strategic lens and the strategic conversation we need to have. So if you think about the TOMs that we measure as part of social value, how do they relate to things like elective care? So if you thought about jobs as one of the outcome measures that we want to see an impact in terms of social value, improving the equity of opportunities, targeting opportunities around disadvantaged groups. Because we've got so many vacancies and we've got a big workforce strategy, there has to be a link between our strategic objective on workforce sustainability and targeting workforce improvement around elective care with social value. There has to be that link there, creating those local opportunities and encouraging employment from disadvantaged groups. And secondly, if we're looking at growth in local business, there has to be a mechanism by which we can connect that story to our elective recovery, let's say. So if we're doing procurement with the independent sector to add capacity, there has to be an opportunity where we're having a conversation with our independent sector partners about their impact on their local communities, their employment practices, their supply chain. There has to be an opportunity then to look at things like small and medium enterprises who are offering digital innovation within elective pathways. And if you think about community diagnostic centres and their impact on the local economy. So there's always a golden thread. There can be a golden thread between social value and the aims of social value and some of those big challenges, strategic challenges we face. It's about making those connections. Thank you, Ariane. And again, just to continue that theme a little bit in terms of those healthy communities. Again, managing waiting lists in terms of equity, we've got a whole range of tools within AGEM to enable organisations to have a look at their waiting lists and overlay protected characteristics, overlay communities, to have a look at how equitable are your waiting lists, and could you readjust and reprioritise your waiting lists whilst people are waiting to make sure that you are more equitable. So that again, that's bringing that social value lens to something very practical like waitlist management. And again, thinking about our estate, I've just talked about the community diagnostic centres and digital. That's really important, but we've also got a carbon footprint and energy management across our whole hospital estate and community estate. And again, that links into our delivery of health and care services. And finally, in terms of those sort of partnerships, how do we continue to create those amazing partnerships that we have, but really strong partnerships with local government, economic growth partnerships to enable those social innovation around a voluntary sector, charitable sector, all of those community assets that we have, which will again link into some of our big objectives around elective care, urgent care, productivity. All of these knit together, I think. And I'm just going to finish with a slide which you'll be aware of, and very thanks, Ariane, if you just move it on, which just repeats that the thing we all know really, because we work in public services, we are anchor institutions, we are part of the community, and it all rolls up nationally. So our sustainability as NHS, health and care providers, and all the associated organisations that work for and part of the NHS and wider local government, our sustainability is tied to the well-being of the population we serve. It's mutually reinforcing and of mutual interest to work together. So I'll just finish with that because I think it's a really nice a nice summary really to say how those things are mutually reinforcing. So I'm going to hand over, I think, next to Dave. So I'll just let Dave introduce himself and the next session. Thank you very much.
Thanks, Alison, and a really great kind of segue in terms of what I want to talk about. That's an old whoever's got that's an old picture. People looking thinking that's a catfish picture. That it's got to be 10 years ago. So I do apologize. I have definitely aged through them, and probably the reason why is because as you can see, I'm currently Associate Director of Sustainability and Partnerships at NHS Cheshire Merseyside. We're one of the biggest ICBs in the country, but former to that, I was a chief officer, or chief exec, or whatever you want to call it, of a small clinical commissioning group, and it was kind of back then, going back 10 years, that we started to, because we were fairly small as a CCG, we were able to kind of expand our thinking in terms of additionality to the everyday kind of clunkiness of the NHS. And it was around that time that we started to look at what social value actually meant in the NHS and what the power of social value can bring. And then I left the CCG and I went to form. There was only 3 of us in the kind of the embryonic ICB and the integrated care board that is now, that you'll see right across the country, the care boards right across the entirety of the UK, and able to build the kind of mechanics that kind of underpin that. But let's have a reality check, as Alison's just said. The kind of everyday working of NHS in terms of social value, we're down the pecking order, right? In terms of the responsibility and what people are managed and performance managed, and we are down the pecking order. So the disciples, if you like, the advocates that are on this call are so important in terms of the journey going forward. So I was tasked with implementing what should be going to place, and we did lots of different work in terms of trying to embed that. But all the way through it, I had an eye on sustainability and what sustainability actually means. So I wrote a portfolio that would mean that this individual would have a heavy lifting job in terms of making sure that sustainability of the ICB in its integrated approach with industry, local authority, voluntary sector, all those different components had a partnership element to it. And looking at things like net zero, looking at things like economic growth, social value, that kind of social determinants and those kind of things. And then it backfired because it ended up me doing it. So I wrote it for somebody else, and then I ended up with the job, which I was more than delighted with, because again, let me tell you, the expertise isn't necessarily embedded in all of those integrated care boards that you'll see. So on that journey, we started to really push forward in terms of Cheshire, Merseyside, and we started to just think outside of the box, and we came up with the social value charter, which was basically there to the social value award, which was there to basically bring all the expertise that we knew across the country and ask and support people to come forward and achieve the award. And it was really just a point of a conversation at that stage. What does it mean in your organisation to have to be able to achieve the social value award, and what does that mean going forward? And what it did was start a much broader kind of set of thinking. And what can be achieved? What can really be achieved by that policy driver? Now, it's such an important policy because if you look at what's happening in social value from then on, so the Hewitt report is now talking about 10% or more in terms of prevention spend, and it's an all-party policy. So as Alison just indicated, what happens in the future in terms of potential government change, it's an all-party. It's not going away. So how do we turn the tide of NHS spend into more of that preventative element? And social value is a really good building block to do that. So we pushed forward and we kept pushing and driving that forward. And then I met Becky, you'll hear from after, who's, if you cut her in half, it says social value right on like a tree. It's rings of social value and expertise. She's an absolute legend. And started to really test me and challenge me in terms of my thinking. So we've gone on from there. We've gone on from there now, and we've set social value in as one of the main anchor frameworks, one of the main criteria in terms of becoming an anchor organisation, as well as the real living wage, as well as kind of net zero and green plans. But your understanding of what you give towards social value is an important ingredient in building the cake of an anchor institute. And so people are really taking it seriously. And we've now, I think we've over 80 or 90 people who's already reached the social value award in terms of our criteria. So launching this national award is so important. It's so important to get that embedded into the thinking and the culture of the new world of integrated work, integrated care systems going forward. There's a number of reasons for that. So I don't believe, I know this is recorded, so I'm probably going to get myself in trouble, but there you go. I don't believe that the NHS, as it stands, is sustainable in terms of its funding. I don't believe that we can carry on just pushing this boulder down the road and expecting government to bail out the NHS continually. We do need to think very, very differently about how we do that. And I think industry, and I think outside of the NHS is so important now. We've been very secular and parochial in terms of our approach. So by meeting industry's social value, so many people I meet who have got multi-million-pound companies who really don't understand how to meet their social value with their corporate responsibility. Through this award, I think we can start to, and through the network, predominantly, I think through the social value network, start to tease out what that means. And you've got big industry working in and around that area. Let's support them and position them in terms of helping reduce health inequalities, helping reduce those kind of burdens that sit in those communities by targeting that kind of social value against the Marmot principles, against the Hewitt report, layering those policies on top of that and enabling those companies to help out. And it used to be called, when we worked in pharmaceutical, taking the devil's pound to do God's work. But I firmly believe that there's a part to play through social value in enabling that. I'll give you a kind of broad example. So we're really, really data rich, but I know that in Liverpool alone there's 17,000 kids, would you believe, without a bed, that don't own a bed. So from a health inequalities perspective, you can have as much data as you want. It's not going to do anything about it. But imagine having a kind of a social value lens on that, to say that through people who work and make money around those communities, targeting that social value, so each of those kids get a bed. Now you can measure that, you can measure the outcomes of that, and you can measure that through the TOMs and various other things that we've built around the work that we've done with the social value portal. That's when you get excited. That's when people get really excited, where people from boardrooms across the country can go to bed and sleep like babies because they know they've done good. And you can do that through targeting policy and targeting the social value element through that conversation. It is so important. So I think, Alison, there's tons and tons we can say more. And I know Becky's far more in tune with the detail than I am, but I don't know where I'd be without her for a start off. That's my social value. Back to you, Becky. My thanks for your work. But I think you've hit the nail on the head here. I think this is something fantastic. I think the value, the award would bring people together to share that kind of stuff. Let's be less parochial. We don't do that here, all that kind of nonsense. If you've got something to share it, nick it, and put it into place, because that's what you're doing. That's your job. That is what you'll get paid to do, is to improve the lives of your communities. So, let's not be prissy about it. And the network, we can bring all that kind of expertise together and just start to grow that maverick, if you like, poking the bear approach, changing how we work in the NHS. It's dead exciting. I think Arden and Jan, I think you're way ahead of the game in terms of if you're thinking of your if you look at the trajectory of where we're going, you're smack on the money. And I, for one, are going to be a massive part of that and a huge supporter. So with massive thumbs up, I'll probably stop it there, Alison, and let you crack on.
Thank you. Thanks very, very much, Dave. And we're handing over to Richard, which is the main event really now, to talk about and introduce and launch the social value quality mark for health. Richard.
Thank you very much, Alison, and lovely to see so many people here today, all with an interest and a passion for social value. As Alison's kindly said, I'm the director of the Social Value Quality Mark, and Social Value Quality Mark has been the starting position of the Social Value Quality Mark in health. So we've started a position to be able to support you from a place of hopefully knowledge and experience on developing such standards, and having worked and supported Dave and the Cheshire and Merseyside team in managing the Social Value Award has been a fantastic insight and experience as well. So good morning to you all. As part of the kind of introduction, really, I could spend 2, 3, 4 hours on just going through this, but I just wanted to highlight about the quality mark and who we are. I wanted to highlight the kind of health and the initial starting position, and then starting to look at some of the benefits and the tools available. We will follow up with a lot more information, so everybody on the call and those who have not been able to join us today will get the benefit of everything. Next slide, please. So first of all, we're a social enterprise, so a not-for-personal profit organisation, and actually being able to work alongside Arden Gem to develop something which is specific to health has been a fantastic journey, because we can build on our knowledge and insight, but actually applying that within a health setting and understanding all those challenges that organisations within health face. Some of the restrictions, some of the processes, and some of those restrictions in terms of locality as well. So we already have the main standard. So the quality mark health is a bolt-on to this standard. Okay, so we're coming from a place of rigor, which is applicable to all organisations. So we've already actually awarded over 200 standards in the UK, from the initial bronze stage all the way up to gold stage, which we can explain later, no problem at all. But it's designed to start to improve transparency, push up standards, push up the knowledge, but also work on the legitimacy of claims. We all see wild and wonderful claims within the UK, both from the private sector, public sector, and the third sector. So this is about actually starting to focus all that enthusiasm, all that comfort, all that direct support, and actually determining what that looks like in reality. And does it stand up? And we're fortunate enough to have awarded the Cabinet Office, the Quality Mark, Kia, as you can see, but also multiple health-based organisations, 2 of which we'll actually hear from today, both Claire from Inspire North and Greg from TTM. And their learning journey throughout this will be such a key understanding and the key point of difference. because this is about suppliers to the NHS as much as it is NHS organisations. So it's empowering everything together. Next slide, please. So essentially what it is, it's about nurturing the standard. Now, we know there's multiple definitions of social value. Central government and the NHS England obviously adopt one. But we're also aware that social value means different things to different people, particularly the communities, patients, families, the ecosystem in which you operate. So this is starting to look about how that can be brought to bear, communicated and celebrated, while still anchoring back to each of the main standards and criteria, methodologies there are in the UK today, including national TOMs, including the social value toolkit, central government, etc. So working in partnership to bring this to you, but also working with you as the development grows to ensure it remains true and harnesses the true potential of social value. And actually bringing that together as award winners, what it keeps it is relevant and proportionate, which we know is always the key milestone of procurement anyway. Now, what we are doing is we're launching bronze today, and we'll then having a cascade of events in the near future, which will build into the different standards, silver, gold, and ultimately onto platinum. So this is not just a one-shot deal. This is not just saying, we're great, aren't we great? Thank you very much. This is about learning and developing and showcasing amongst all of the healthcare community to say, look, this is great, this is working, this is developing. So next slide, please. So the benefits of applying, actually, we're going to hear a little bit about this anyway in the very near future on this session. But what we've found during the trials and the piloting that we've initially done is that this is about bringing your social value understanding and offer to bear. What this then does, it enables you to develop a framework of how you research, measure and report your value to your core stakeholders. So that can be a part of compliance, but this can also be into the community and your supply chain and your partners. So this is bringing in and showing that recognition. So bronze is about making a commitment to measure and report your social value in the public domain in alignment to what your stakeholders value. What it also gives is an understanding of what you stand for as individual locations, individual organisations in your own right, because London is different to the northwest, to the northeast. There's different criteria, different expectations, different demographic, all of which want things slightly different, and harnessing the power of community, people, process, and supply chain enables you to achieve far greater results in what we're hearing is a limited budget, in a changing world, in a cost of living crisis and general elections, etc. But it all links back to ensuring that you can demonstrate value. Next slide, please. So the bronze, as I said, it's your first step. Now, some of the key criteria, without going too much into too greater detail, is having an executive sponsor and a social value lead. Now, these can be part of a person's responsibilities or a dedicated position. Now, this is all about ensuring that you have that continuity and accountability for social value. The next element will be having your own social value definition. What does social value mean to you? What does it mean to your stakeholders? Have you asked them? Have you drawn that in? Speaking to staff, speaking to the community, so it resonates. And then defining what your legacy is, because there's so much value that can be created and can be delivered. So what does that look like? What is that long-term objectives? And then looking at developing your own pledges, so own commitments in different areas for health, in education, in employment, in community. Just because you're a health-based organisation, you have so much great value in community development, social cohesion. education, skills, employment. You are large employees in your own right. So it's harnessing that power and being able to translate that to your key stakeholders who can then help you on your journey. And then turn it into what we call KVIs, key value indicators. So these are effectively your KPIs of the social value world. And what these now start to do is give you a direction and a focus and a way of performance managing your social value in the future. And then the last major criteria is a route map of how you get to from your commitments to measuring and reporting your value within 12 months. Now, we're not saying what particular methodology you need to use, whether it's social return on investment, etc. What we are saying, it needs to be relevant and proportionate to what your stakeholders value. So it's very specific to you. Our team will then review and evaluate to ensure that is actually clear, transparent, actually links back to what your stakeholders value, and then we'll gladly award you for 12 months. The next step is very simple, is you would be audited based on your commitments, on your pledges and your key value indicators by simple document review, stakeholder engagement, coordinating the results and ensuring that you've actually hit the main criteria, which that will come out in due course. You don't need that for level 1 or bronze. Next slide, please. And then finally, we've got a host of resources because just going through that 10 minutes is only a small snippet, as you can imagine. So effectively, go onto both websites, go onto Arden Gem and our website, a Social Value Quality Mark. There's a dedicated microsite. You can download the initial brochures. They're all now live. And we've got a good series of assets and communication tools coming out in early part of 2024, which is going to help you on your journey and being able to support you on your individualized journey. Thank you very much for listening. Over to you.
Hi, my name's Claire Walker. I'm Head of Quality and Business Support at Inspire North, and I'm here today to talk to you about our social value journey. Next slide, please. Okay, so before we start, I'll just give you a brief overview about who we are. We are a voluntary sector organisation, and Inspire North itself is the parent organisation of 2 charities, which provide valuable support to vulnerable people within our communities. So this includes people with mental health, people that are homeless or at risk of homelessness, people with dementia and their carers, people experiencing or have experienced domestic abuse, and also support for perpetrators of domestic abuse as well, to try and prevent that abuse cycle. Our mission is creating a world where everyone matters, and this is underpinned by our core values, so people, integrity, collaboration and passion. Next slide, please. Okay, so Inspire North was formed back in 2018 when we brought together Community Links and Foundation, and that created the Inspire North group. And we work across the north of England, so from Doncaster right up to Durham, and we include all of Yorkshire and the Humber as well. And as you can see from the slides, we're proud that we've got award-winning services, and we also deliver accredited training, and that's in things like mental health, wellbeing, housing, domestic abuse. So we share our knowledge and expertise externally. And that includes training that I'm sure you've all heard of, such as mental health first aid and the suicide, so assist and safe talk as well. And again, from the slide, as you can see, our work is evidenced through all our accreditations. And on that slide, we're really now proud to showcase our bronze and silver social value quality marks, which really make us stand out against our competitors. So there aren't any charities delivering similar services within the regions that we work that can say the same. So for us, that is just a fantastic achievement, something that we're really proud of. Okay, next slide, please. Okay, so let's have a look at our social value journey. So we set about our social value journey in November 2021, but we had been talking about it for many months before then. So as an organisation that delivers support within communities, that helps people into housing and to sustain their housing, that develops people's confidence, resilience and skills to live independently, and also access things like education, training and employment, we were already delivering a huge chunk of social value. We just didn't know how to quantify it and put a value on our impact. But even more importantly, social value was becoming increasingly an increasing driver for public procurement, and it still is. So back in September 2020, there was a public procurement note that was issued that actually gives social value a minimum weighting of 10% on our tender scores. But not only that, it also states that any benefit identified as social value in tenders has to be above and beyond the core deliverables of that contract. So in addition to what we're paid to deliver, which of course, being in the healthcare sector, that's a huge challenge for us, and it still is. So in the beginning, we didn't know where to start with social value. And so to support us, we engaged Social Value Business and Rich. In all honesty, if we hadn't, we wouldn't be where we are today. And with that lovely shiny silver accreditation that we're really proud to display. As you can see from the slide, the project was launched in November 2021. And between then and now, we've delivered a lot, too much to cover today. But the slide highlights the key parts. And we'd initially set ourselves a time frame of 9 months. And as you can see, it did take a lot longer. So between February and March, we conducted our gap analysis. And this was to identify gaps in our approach to social value and our compliance with what is now the bronze accreditation. And we had many gaps, and that was to be expected, but it was a really useful and much needed exercise to really see our starting point and understand what we needed to put in place for our social value. Between May and September 22, we focused on co-production of our strategy and developing our key measures, which Rich was talking about earlier, so our key value indicators, our pledges. And this was all done working with colleagues from across the organisation and our trustees, so it was all co-produced, and it was fully supported by Social Value Business. So they led the sessions, they walked us through the process. So our strategy was launched in October 2022, and then in November, we achieved our bronze accreditation. The buzz in the office that followed the award was absolutely amazing. It sounds easy on paper, but a lot of hard work went into this, and we didn't let that go unrecognised. Our focus for December 22, right through until kind of where we are now, August and beyond, was setting up our internal processes and systems, and also the challenge of engagement. So trying to really get that buy-in from services. We were gathering data, we were completing client and stakeholder surveys and establishing our baseline, so giving us something to measure against. And then we got our baseline report, and we've finally achieved our silver award. At that point, it was a huge relief to be awarded the silver. We'd put in so much time and effort into it. We'd gone through numerous team changes due to turnover, sickness, and we simply underestimated the size and scope of our organisation, just how many services there were, and also just how we don't have that kind of one-size-fits-all structure. Our services are very different and work in different ways, and that did throw out a few challenges. But Social Value Business supported us throughout this. And again, we wouldn't be standing here, or I wouldn't be sitting here today without them. So thank you. Thank you, Rich. Okay, next slide, please. So we did it. Was it worth it? Absolutely. So this slide just looks at some key benefits and some top tips. So in terms of benefits, the accreditations showcase Inspire North's experience and commitment to delivering social value. They give us material to celebrate and shout about our social value through our website and social media channels. We now have tangible impact data in relation to social value that we deliver as a group, and this is invaluable. And it strengthens our bid responses, supporting the organisation's sustainability and growth. So in bids, we can demonstrate that we've got these accreditations, and that makes us stand out, and we can give impactful data. We can use our baseline report. We've got examples and quotes that we can use, but we're not there yet. We don't have a means to forecast additional social value for our bids, but we're continuing to engage with Social Value Business to make that happen. So, you know, it's an ongoing process. And we're going to go for our next accreditation as well. So we're going for gold, and we're excited about that. And this will really help us to fully embed social value within the group and provide that full 12-month social value data to compare to our baseline. And of course, all being well, achieving another award that we can share and shout about as part of our bids and social media. So if you're thinking about starting your own social value journey, here are our kind of top tips and things to consider. Don't underestimate the size and scale of the organisation. Be realistic, expect setbacks, set achievable timeframes, and expect to fail and have to change your approach. It isn't a linear process. Get buy-in from key stakeholders, especially those on the ground. So those people working with clients, patients. It has to be a collaboration. All perspectives are needed to ensure success. To help with this, build it into your service plans, your annual plans, your strategies, whatever tools you have, so that everyone shares that same goal. You're all working to that same goal, same priorities. That will really help with buy-in. And you need a really robust project plan, and it needs to be delivered by a strong and diverse project team. Again, collaboration is essential to success. Invest in consultancy. I can't say it enough. You need that consultant to lead you through the process, especially if you're a large organisation like ourselves. I'll say it again, we wouldn't be where we are today without social value business. And keep internal stakeholders informed. So whatever your internal communication channels are, use them. So intranet, briefings, training, communication is key for continued buy-in. And I'd say do a lot of face-to-face communication as well, because I think that really helps promote engagement. And celebrate your achievements, no matter how small. It's not an easy job. Celebrate and take pride in your efforts. Next slide, please. So before we close, I just wanted to share a couple of testimonials. This has come from our baseline report. I won't read them out, they're there for you to have a look at. The baseline report is available on our Inspire North website, and the closing slide that I've got has got the address on there. There's also a link to a video we've produced around social value that's available on YouTube. But our website's got all our news articles on social value, so do take a look. And of course, if you do have any questions, if you want me to talk through in detail around our journey, then please do get in touch. We'll be more than happy to do that. Thank you.
Thank you, Claire. That was amazing. Thank you so much. Please hang on, because I think there'll be questions for you. Let me hand over to Becky now. Thanks.
Thank you. Thanks, Alison, and thanks, Claire. I'm really conscious of time, and I want to make sure Greg has time to speak as well. So I'll talk through my slides quite quickly, but we can pick up at the end, and you can always send messages afterwards. Next slide, please, Ariane. So I'm going to talk to you really about how Arden and Gem can help you on your social value approach. So we've got two main ways. We've got membership of the Social Value Network, which I'll talk through, and then we've got this, the consultancy support to help you get through the social value quality mark as well. Next slide, please. So as has been spoken about, social value, it's the right thing to do. People know they need to do something, but they're not really quite sure. So we need to have that consistent and flexible approach. And it's about working together, co-producing. And I always see things in jigsaws. So if everybody understands the overarching picture and sees their piece in that jigsaw, that's how I see things. So what we've got is this framework to help you and make your jigsaw. Next slide, please. So we've got the Social Value Network. So this has been invested in by Arden and Gem, and it was almost like a concept, if you like. And we went out and we spoke to people. We got lots of insight, lots of comments. And as time's gone on, we've developed that to be something which is taken on board lots of comments that people have said. And it's all about making the maximum impact for colleagues, for customers and local communities. And if everybody joins in and does their bit, we can maximise that output. We can help people to do what they want to do. We can work to understand what the local organisations, what the local communities need, and we can grow that skills, knowledge and money within the sector and the sectors in the wider healthcare way of working. So we can just keep to grow this. And the more we grow, the better impact. Sorry, Ariane, carry on. It's okay. Next slide, please. The better impact we can make. So within the network, and I'll go through some slides in a bit so you can see what it looks like, but we've got clear bespoke guidance. We can help you to do your specific approach. We can do that in different ways: advice, guidance, support, or embedded roles. And it's about working across the whole sector to help you deliver what you need to do, but working in cooperation and co-producing with others. We've also got our Social Value Advisory Board, which you can have access to if you're in the network. Next slide, please, Ariane. So you can see here we've got experts from across the NHS, local authorities, voluntary sector, private sector, and these are all subject matter experts. And if you come and join the network, you can have access to these people. We'll be giving webinars, helping you out to help you, with specific things to really help you crack that nut and do the approach that you want to do. Next slide, please. Thank you. So as I say, what we've been able to do as well, when we're having conversations, people are saying, yeah, this is great, it's best practice, it's documentation, but we also want to have some assurance that we're doing the right thing. So that's what led to the conversations with Rich and the social value business. So we can take the work we did in Cheshire Merseyside and take that then to help on a wider perspective. So we can now align this. If you can join the network, we can help you on that bespoke approach and also help you on your journey to get to the quality mark for health as well. Next slide, please. Thank you. So there's also a free site here on the Future site. We've got well over 200 people on here now, and this gives you all of the free advice, all the free information, what's happening from a social value perspective. Next slide, please. And then we've got our dedicated website. So if you come and join on the network, we can work with you to understand where are you, where do you want to be, how are you going to get there. We can give you some training, we can give you specific advice and support. We can help you in whichever way is right for you. So we've got the overarching framework, and the overarching framework is to improve and increase the social value that's delivered across the country. Next slide, please. And everything is safe. So we've got a vault in there, it's password protected. You can go in there, you can build up the work that you want to do. So do you want to focus on anchors? Do you want to focus on net zero? Is it having a social value charter? All of these things we can work with you to help as you build up your approach to delivering what you need for your local area, and then also for the award as well. Next slide, please. And you can move on to the next one as well, please, Ariane. So as has been spoken about, the Bronze Award, we can help you with this. So working with Rich and the team, we can help you to say, if you want to get the bronze, this is what you need to do. This is a consultancy support we can help. We can put that on the network. It's in a secure place, and it just really helps to grow and develop your approach to delivering social value. Next slide, please. So that's from me, really. What's next? We want to grow this. This is a movement. Dave calls them the disciples. We want people to come. We want to bring everybody along with us. We want to grow that knowledge and experience, and we want to make a difference. We can help you do that. We can help you get accredited, and we can help us move that bar so we can all get to the next phase. This is something that we really, really need to do, and we've got all the tools there. We just need you to come and join and help to take us to the next level. So that's a very quick canter through, but I was really conscious you still got other speakers. So thank you very much.
Thanks, Becky. Let's whip straight through to Greg to give him 10 minutes. Thanks, Greg.
Hi, thanks everyone. Thanks for firstly kind of inviting me to talk, and I've learned lots, so thanks to everyone who's presented so far. I did chuckle when Rich was labelled as the main event, but actually, hopefully as I go through these slides, you'll see that I can't actually argue that fact, despite wanting to. So if we can move to the next slide. Thank you. Oh, I shouldn't have gone with these animations. Perfect, thank you. So I'll very quickly touch on who we are, why social matters to me and TTM, how the social value quality market supported TTM's journey, and how social value is shaping TTM Healthcare Solutions' future moving forward. So next slide, please. Thank you. So who we are. So TTM Healthcare Solutions, we work and are dedicated and are specialists in the healthcare market. We very much focus on talent and people, and our strapline, as you can see from the top right, is that we power potential. We do that through working with customers in the healthcare sector, whether it be private, public or voluntary. We do that through healthcare workforce solutions, whether that be temporary workforce solutions, permanent, international workforce solutions, where we actually source talent globally and bring that to our customers, And we also work with regards to healthcare process outsourcing, and that's kind of helping out and augmenting internal resources or entirely outsourcing processes to enable health services to kind of focus on those frontline and kind of services that are really required. Underpinning that is our workforce technology and our global workforce, whether that be internal or external, that are based in Ireland, the UK, South Africa, India, the Philippines. So in terms of numbers, very quickly to kind of contextualize all of the above, every week we put out temporary workers, our people, to 3,200 of them there are, to flexible kind of temporary work each week. And each year we place permanent placements each year, whether that be nurses, doctors, allied health professionals, into healthcare services, both in the UK and Ireland and Northern Ireland. So a significant kind of rolling workforce, as well as our own internal workforce. So I'll bring some more context to why that matters shortly. Next slide, please. So in terms of why social value matters, I think firstly, before I kind of touch on the little bubbles we've got here, is it's just the right thing to do, simply. And I think from a commercial perspective, it's a real key differentiator. And, you know, it's the only way to operate really in the future. Partnerships and relationships, whether they be with any one of these core 4 stakeholders on the screen, need to be mutually beneficial. As you can see from the left-hand side, we've got candidate colleagues. Those are who we consider our people, and we've focused an amount of our social value effort, or as we've labelled it at TTM, positive impact to our people, and that's to our candidates and our colleagues, so external and internal workforce, our people. Obviously, customers are a key and, you know, very, very important factor. So NHS customers, we've got a number of and work with many over the years. They're imperative to our success, and we need to continue to evidence and support that we can help them with their social value efforts, deliver on top of those, and ensure that collectively we deliver, maximise the positive impact we create. The community, obviously, they are key. So we're very focused on supporting and nurturing the communities that not only that we work in, but also where we are delivering services. So we're only going to achieve that through ensuring actually our approach covers all 4 of these stakeholders. Next slide, please. So in terms of how the social quality mark, social value quality mark supported our journey, I think when I first kind of encountered social value at a previous organisation, and to a degree here at TTM as well, people didn't quite get it at first. They were very stuck in the CSR mindset. So Rich and the team at Social Value Business really helped contextualise what social value is and what we needed to do to contribute to that, and how we could kind of take our CSR effort, which is often passive, and make it active and proactive. So really did help myself and the wider team within TTM build context. And then once we had that context, we were able to take it forward and get buy-in and sponsorship from key stakeholders around the business, which is key, because the only way you're going to move social value forward and positive impact is by bringing your people with you. So once we achieved that and we had the sponsorship and the buy-in, it was then time to kind of put together the vision and the mission statement and charters and commitments. That context and buy-in was key to that. Once we had the vision and the mission, it was then a case of actually ensuring that we align it to everything in terms of our business, our operations, how we are perceived internally, externally, and of course, educating everyone within the business and bringing them along with us. And I'll touch on that shortly. Next slide, please. So again, and expanding on our social value journey with the quality mark, we've progressed, I would say, to either a version 2 or possibly even a version 1.2. Rich can be the judge of that when I'm sure we'll have a coffee in the near future. We've moved it on to actually embed it deeper and further within our business. So we weren't quite happy in terms of actually the social value and our perception of it and our initial charter and commitments working from across our business. So we are set up in, as I mentioned earlier, globally, but our predominant customer base in the UK, Northern Ireland and Republic of Ireland. The Republic of Ireland has got a very different view and approach currently on social value, So it's ensuring that we had a compatible model that worked across all regions that we work in. And as well as that, also making sure it works for the different stakeholders and really encapsulates all the different stakeholders that we work with. So to enable that, we created 4 impact pillars to drive the initiative and obviously synergizing the themes and outcomes to deliver on those. So we embedded those by bringing them into our family principles. We don't have values here at TTM. We've gone a step further and evolved those. And those are family principles that we use every day when we turn up to work. So we found a home for positive impact within our principles. So that applies to everyone. And that's something that's socialised often and always in every conversation. And to ensure that actually we're doing the right things and we're monitoring and measuring our key value indicators, it's also got a home within our playbook. And the playbook is something and a tool that is used at board and management level to kind of ensure that we are looking forward, we are planning and we're working accordingly. And again, it's got a robust home there that is discussed at all board meetings and then cascaded down. So that's an impact chapter within the playbook. And in terms of the family principles and where HAV lives, the 4 pillars of HAV are happy people, accessibility and inclusion, valued member of the community, and environmental choices. It's one thing that I have learnt and found, and Rich has really helped out with, as well as the solid and robust context that set the foundation, is always try and simplify. One, it helps you keep focused and deliver. Secondly, it also enables you and helps you to bring the people along with you. Next slide, please. So I won't labour on with this slide, but these are our principles. Yes, we've got 15, and you might think typically you'd see 4 or 5 values. We think it's very important to have family principles, and this is how everyone lives and works by every single day. So as you can see, number 14 is have positive impact, and that is socialised and always part of the mindset of every colleague within TTM. Next slide, please. So wanted to take it a step further to not only have it in our principles, in our board structure and meetings, we wanted to make a bold and broad statement and commitment to social value and positive impact. So our key vision and mission is 3x, 10x. 3x, we want to be 3 times the size. There's always going to be a commercial element to our business. I can't apologise for that. But our key measure of success is that we deliver 10x, so 10 times the positive impact. And if we achieve 3x without delivering on 10x, the board and the organisation sees that as a failure. Our key success and focus is 10x. We only want 3x if we can deliver on 10x, and that is fundamentally important. I'll take you through the foundations of that very quickly. I'm conscious of time on the next slide. As you can see here, we've got 3x main things, 10x main things. On the right hand side, that's where I'd like to importantly focus. Those are the HAV pillars, and you can see the different levels in terms of what is enabling our delivery of those and what they're founded on. So very importantly, family principles, playbook, technology, our people, supply chain, including VCSE partners, and of course our customers. It's all founded on commercial rigor, entrepreneurial bravery, and a drive for innovation. So we thought very far and wide in terms of what we need to do, how we need to do it, where we need to do it, and when we need to do it. That's everything. Apologies for going over slightly. You can click to the next slide or go back to the standard depth. Thank you very much for your time, everyone.
Thank you so much, Greg. I could say we've saved the best till last. That might help, would it, with the main event comment earlier? So, but that was amazing. I absolutely love the 3 times 10, and I think it's something that the NHS could easily sort of adopt and think about. You know, we've got our core duties, but what's that wider impact and how do we measure it? So I think that is amazing. So thank you so much to everyone today. We've only had one critical question, I think, in the chat, and that's about these 4 trusts. So I don't know if you want to just square that off now, Richard, if you have them to hand, or you could just let us know who they are. Or yeah, you're on mute. Sorry.
Always had to be one. It had to be me. I can confirm no ICBs have been awarded. I can confirm 3 out of the 4. The 4th one wants to remain quiet about it because I want to see it as a bit of a USP. their choice, but the three I can say is Bedford, Lancashire, and also the Wirral.
Thank you. It just gives us a starting group, really, who can start to share their story, really, about the value that this is, you know, so it would be great to hear a little bit more about that as we go forward. So, yeah.
For sure.
Yeah. So thank you, everyone. We've gone slightly over. All of the slides will be shared. Thank you for all your time today, and we'll look forward to connecting with you in the weeks to come.
Thank you, everyone.
Thank you.
Thank you all.